Dr. Richard Alden publicly stripped his scrub nurse of her credentials, labeling her a clumsy, incompetent liability. 2 weeks later, a military Black Hawk rattled the hospital windows, and 4 high-ranking Pentagon officials stormed the surgical wing, not seeking the brilliant chief of surgery, but the very woman he had banished. Seattle Metropolitan Hospital was a cathedral of modern medicine, a place where miracles were routinely manufactured under the blinding glare of surgical halogens. At the apex of this high-stakes ecosystem was Dr. Richard Alden, the chief of surgery. Alden was a man whose brilliance with a scalpel was eclipsed only by the sheer magnitude of his ego. He demanded perfection, operating with a tyrannical rhythm that left his residents terrified and his nursing staff walking on eggshells. And then there was Claire Hastings. To the rest of the surgical wing, Claire was a mystery wrapped in an infuriating enigma. She was a woman in her late 30s, quiet, unassuming, with a gaze that always seemed to be scanning the room for invisible threats rather than focusing on the immediate task at hand. While other scrub nurses anticipated a surgeon's needs with mechanical grace, Claire often hesitated. She would double-check monitor readings that weren't her responsibility, stare blankly at the anesthesiologist's hands, or pause right before handing over an instrument as if running complex calculus in her head. The staff whispered about her. They called her Jumpy Hastings. She had a habit of flinching when a metal tray clattered too loudly. Twice in the past month, she had accidentally bumped into the sterile Mayo stand, nearly knocking over rows of meticulously arranged clamps and forceps. Dr. Alden despised her. He saw her hesitations as a lack of focus, her hypervigilance as plain anxiety, and her clumsiness as a liability that threatened his pristine surgical record. Nursing is a symphony, Hastings, Alden had sneered at her after a particularly grueling appendectomy where she had dropped a sponge forceps. You're playing a tuba in the middle of a string quartet. Get your act together or get out of my OR. Claire had merely nodded her face, entirely devoid of the tears or panic that Alden usually managed to wring from his subordinates. "Yes, doctor," she had murmured, her voice steady, betraying absolutely nothing. That stoicism only made Alden hate her more. He wanted deference. He got only discipline. The breaking point arrived on a rainy Tuesday morning during a high-profile procedure. The patient on the table was Seattle's incumbent mayor, Thomas Reed, who had been rushed in for an emergency bowel resection following a severe rupture. The observation gallery was packed with hospital administrators, keeping a nervous watch over their most prominent patient. The tension in OR4 was thick enough to slice with a number 10 blade. For the first 2 hours, the surgery proceeded flawlessly. Alden was in his element, holding court, narrating his movements for the gallery, with the theatrical flair of a seasoned performer. Claire stood opposite him, masked, and gowned, her hands hovering over the instrument tray. "Hemostat." Alden commanded, extending his gloved hand without looking up from the surgical field. Claire picked up the hemostat, but paused. Her eyes darted from the open cavity to the monitor, tracking Mayor Reed's blood pressure, which had just ticked down by an imperceptible margin. Then she looked at the patient's lower abdomen, noticing a faint, dark pooling of fluid near a secondary artery that Alden's retractor was currently obscuring. "Hastings, hemostat." "Now." Alden snapped his fingers, twitching in the air. "Doctor, his pressure is dropping. There's a microperforation near the inferior mesenteric." Claire began, her voice low but urgent. "I didn't ask for a diagnosis from a nurse," Alden roared, his head snapping up. "I asked for a damn hemostat. Do you know your job or not?" In her rush to comply, while keeping her eyes locked on the hidden bleeder she knew was about to burst, Claire stepped forward. Her foot caught the thick, heavy cord of the suction machine. She stumbled. It was a slow-motion disaster. Claire threw out her hands to catch her balance, crashing hard into the primary instrument table. The screech of metal on metal echoed through the room as dozens of sterile scissors clamps, retractors and scalpels cascaded onto the bloody linoleum floor. The entire operating room froze. The silence was deafening, broken only by the rhythmic beep of the heart monitor. Alden's eyes above his surgical mask were wide with unadulterated fury. He looked at the floor, then at Claire, who had quickly righted herself. Her breathing perfectly controlled, despite the chaos she had just caused. "Get out," Alden whispered, his voice trembling with a rage so profound it was almost quiet. "Dr. Alden, if you don't clamp that artery immediately—" "I said get out," Alden screamed, pointing a blood-stained glove toward the electronic doors. "You are a hazard, Hastings. You are incompetent, Clumsy, and you are entirely finished in this hospital. Someone get me a new scrub nurse and a fresh tray now." Claire didn't argue. She didn't plead for her job. She took one last hard look at the surgical field, stripped off her sterile gloves, dropped them in the biohazard bin, and walked backward out of the OR, her eyes never leaving the monitors until the heavy doors swung shut. 30 seconds later, the hidden bleeder Claire had tried to warn him about ruptured. Blood flooded the surgical field. Alden panicked, cursing violently as he scrambled to find the source. It took him 5 agonizing minutes and 2 units of whole blood to stabilize the mare, a crisis that could have been avoided had he listened. But in Alden's mind, the complication was entirely Claire's fault. Her clumsiness had distracted him. By 3 o'clock that afternoon, the disciplinary hearing was over before it even began. Sitting in the hospital administrator's office, Dr. Alden delivered his ultimatum. "She goes or I go. She is a bumbling liability. She lacks the nerve for high-pressure medicine." The hospital director, desperate to keep his star surgeon happy, offered a compromise. Claire wouldn't be fired, the union would throw a fit without a longer paper trail, but she would be permanently removed from all clinical duties. "You're being reassigned to the sub-basement. Hastings," the director said, refusing to meet her eyes. "Inventory management. You'll be counting gauze, organizing IV bags, and managing supply logistics. Effective immediately." "Understood," Claire said softly. She stood up, her posture remarkably straight, and walked out of the office. Alden scoffed as the door closed. "Good riddance. Let her trip over boxes in the dark. At least down there she can't kill anyone." For 2 weeks, the sub-basement of Seattle Metropolitan Hospital was Claire Hastings' entire world. It was a cavernous, windowless concrete bunker, smelling faintly of ozone and industrial floor cleaner. Rows upon rows of wire racks held the lifeblood of the hospital, above thousands of saline bags, surgical kits, intubation tubes, and sterile linens. If Claire was devastated by her dramatic fall from grace, she never showed it. She approached her inventory duties with a terrifying mechanical precision. She reorganized the trauma supplies, grouping them, not by alphabetical order, but by the chronological necessity of a mass casualty event. She worked in silence, preferring the hum of the ventilation shafts to the petty gossip of the hospital above. Upstairs, Dr. Alden was holding court, relishing his victory. He frequently used Claire as a cautionary tale for the new nursing recruits. Focus and grace. He would lecture them in the hallways. Without it, you end up counting bandages in the dungeon like our dear Ms. Hastings. The hospital fell into a comfortable, arrogant rhythm. Until Tuesday morning. It began as a low, throbbing vibration that rattled the coffee mugs in the doctor's lounge. The vibration quickly escalated into a deafening roar. Dr. Simon Peterson, the head anesthesiologist, walked to the 4th-floor window and pushed aside the blinds. His jaw dropped. "What in the world?" Simon muttered. Hovering just a few dozen feet above the hospital's main parking lot was a military UH-60 Black Hawk helicopter, painted matte black with no visible tail numbers. The sheer force of its rotor wash sent pedestrians scrambling and ripped a nearby banner from its poles. The chopper didn't bother waiting for clearance. It descended rapidly, touching down heavily across 3 disabled parking spaces, right in front of the main emergency entrance. Before the rotors even began to slow, the side doors slid open. 4 men stepped out. They weren't medics. They were dressed in crisp, dark suits, moving with the unmistakable predatory coordination of highly trained federal operatives. Leading them was a tall, broad-shouldered man in a fully decorated United States Army dress uniform. The silver stars on his shoulders caught the dull morning light. Inside the hospital lobby, panic erupted. Security guards rushed forward completely out of their depth, waving their hands defensively. "Hold on! You can't land that thing here. This is a civilian hospital." The head of hospital security yelled over the dying whine of the helicopter engine. The general didn't even break his stride. He walked straight through the sliding glass doors, his suited escort fanning out to secure the immediate perimeter. One of the men calmly reached into his jacket, pulling out a heavy leather wallet, and flashed a Department of Defense badge at the trembling security guard. "Federal authority. Lock down all exits." The agent said, his tone leaving absolutely no room for debate. "Nobody leaves this building until we are done." General Arthur Campbell approached the main reception desk. The receptionist, a young woman named Brenda, was paralyzed with fear. "I need to see the chief medical officer or the chief of surgery. Right this second," General Campbell commanded. His voice wasn't loud, but it carried the weight of a man accustomed to ordering airstrikes. Brenda fumbled for her phone. I'll page Dr. Alden." 2 minutes later, Dr. Richard Alden stepped off the elevator into the lobby, annoyed by the interruption to his morning rounds. When he saw the armed men securing the doors and the 2-star general standing in the center of the room, his annoyance instantly morphed into a mix of confusion and self-importance. Alden straightened his white coat, adopting his most authoritative expression. He naturally assumed this dramatic arrival was a desperate plea for his renowned surgical skills. Perhaps a visiting diplomat or a high-ranking official had been critically wounded nearby. "I am Dr. Richard Alden, Chief of Surgery," he announced loudly, stepping up to the general. "Whatever emergency you're dealing with, you've come to the right place. My OR is being prepped as we speak. Who is the patient, and what is the nature of the trauma?" General Campbell looked at Alden, his eyes cold and unimpressed. He didn't shake the surgeon's extended hand. "We aren't here for you, Doctor," Campbell said flatly. Alden blinked his hand, dropping slowly to his side. "I don't understand. I am the top trauma surgeon in the Pacific Northwest. If you brought a casualty in that helicopter—" "There is no casualty in the bird." "Not yet," Campbell interrupted, stepping closer to Alden, towering over the arrogant doctor. "We have an active, highly classified crisis at a secure facility 50 miles from here. We have a critically wounded operative exposed to a specialized synthetic biotoxin accompanied by severe ballistic trauma. Then fly him here," Alden countered, trying to regain control of the conversation. "My team can handle—" "Your team would be dead within 10 minutes of opening his chest cavity." Campbell snapped, his patience evaporating. "This requires specialized battlefield extraction protocol and containment surgery that civilian doctors are not cleared nor trained to perform." Alden frowned, utterly bewildered. "Then why the hell did you land on my front lawn, General Sarceptor?" Campbell pulled a secure tablet from under his arm and tapped the screen. "We are here to collect the only medical specialist on this side of the country who is authorized and qualified to handle this specific extraction." Campbell looked up, his gaze boring into Alden. "Where is Major Claire Hastings?" The lobby went dead silent. Nurse Brenda gasped. Alden actually laughed, a short, breathless sound of sheer disbelief. "Hastings. You're looking for Claire." "Hastings, General, there must be a clerical error. Claire Hastings isn't a major. She's a nurse, a scrub nurse, and a terrible one at that. She's a clumsy, jumpy liability whom I personally demoted 2 weeks ago." The air around General Campbell seemed to drop 10 degrees. The suited men behind him shifted subtly their hands, resting near their waistbands. "You demoted her?" Campbell asked, his voice dangerously low. "She knocked over an entire sterile tray during a mayor's surgery," Alden insisted, feeling an inexplicable cold sweat breaking out on the back of his neck. "She's practically shaking half the time she's currently in the sub-basement, counting gauze." General Campbell stared at Alden for a long, terrible moment. "You arrogant fool," he finally whispered. "She wasn't shaking, Doctor. She was experiencing hypervigilance, a lingering symptom of surviving 2 helicopter crashes and 60 straight hours of active combat triage in a hostile Syrian hot zone. Major Hastings is a decorated operative of the Joint Special Operations Command. She spent 10 years operating inside black site medical tents, where the sterile trays you care so much about were improvised out of ammo crates while under mortar fire. Alden's face drained of all color. His mouth opened, but no sound came out. "She retired to civilian life to find peace." Campbell continued, his voice dripping with absolute disgust. "And you shoved a Silver Star recipient into a basement because she bruised your pathetic ego. Now take me to her, immediately." Without waiting for a response, Campbell shoved past the paralyzed chief of surgery, heading toward the elevators, leaving Alden to chase after him like a scolded child. The elevator ride down to the sub-basement was the longest 70 seconds of Dr. Richard Alden's life. General Arthur Campbell stood rigid, his jaw set in a hard line, while his 2 heavily armed JSOC operatives flanked the doors. Alden, backed into the corner of the elevator cab, was sweating profusely through his designer scrubs. "General, listen to me," Alden stammered, attempting to salvage some shred of his crumbling authority. "Whatever military record she has been severely compromised since entering civilian medicine. If this agent is exposed to a biotoxin, you need a premier cardiothoracic surgeon. You need me, not a traumatized scrub nurse who can't even hand over a hemostat without flinching." Campbell slowly turned his head to look at Alden. His expression was one of profound pity. "Dr. Alden," Campbell said, his voice a low rumble over the hum of the elevator. "Major Hastings wasn't flinching in your operating room. Her threat assessment training dictates that she track every anomaly in a room simultaneously. When your mayor's blood pressure dropped, you were too busy giving a speech to the gallery to notice. She saw the microperforation before your monitors even registered the systolic crash. She deliberately tipped that sterile tray to force a hard reset of your surgical field, because she knew if you didn't stop your grandstanding and look down, the patient would bleed out in 90 seconds. Alden swallowed hard. The color completely vanished from his face. That's impossible. She tripped." "JSOC operatives do not trip, Doctor," Campbell replied, just as the elevator chimed. The heavy metal doors slid open, revealing the cavernous, dimly lit expanse of the sub-basement. Rows of wire shelving stretched into the shadows. The air was thick with the smell of cardboard and antiseptic. At the far end of aisle 4, sitting calmly at a metal folding table, was Claire Hastings. She wasn't wearing her standard blue surgical scrubs. She was dressed in dark grey hospital fatigues, meticulously logging inventory on a clipboard. When the heavy footsteps of the military boots echoed across the concrete floor, she didn't jump. She simply placed her pen down, stood up, and squared her shoulders. "Major General Campbell called out, stopping 10 feet from her table. "I'm a civilian now, Arthur," Claire replied. Her voice, usually soft and deferential in Alden's presence, was suddenly sharp, resonant, and entirely stripped of its manufactured meekness. "I wouldn't be standing in a basement if we had another option," Claire Campbell said, dropping the formalities. "We have a critical situation at the Rainier Black site. Agent Jonathan Hayes. He was compromised during a raid on an illegal laboratory off the coast. He took 2 5.56 rounds to the upper thorax, but that's not the problem." Claire's eyes narrowed her mind, instantly shifting gears. "What's the payload?" "A synthesized VX Novichok hybrid. Compound 73. Campbell answered, his grim tone echoing off the concrete walls. The rounds were hollow points, packed with glass ampoules of the agent. The ballistic impact shattered the ampoules, but the tissue encapsulation in his chest cavity has temporarily contained the liquid. If the cavity is opened with standard surgical force, the atmospheric pressure shift will vaporize the toxin. It will kill him, and it will kill everyone in the room." Alden, standing behind the soldiers, gasped. "That's suicide. You can't operate on a localized chemical bomb." Claire ignored the surgeon completely, her eyes locked on Campbell. "Has he been given atropine?" "Maxed out," Campbell said. "He has 45 minutes before the tissue necrosis breaks the containment naturally. I need you to perform a zero-pressure extraction in full Level A hazmat gear. You are the only person on the West Coast who survived the Syrian chemical triage protocols. I need you in the air right now." Claire didn't hesitate. She didn't ask for permission from the hospital director, nor did she look at the chief of surgery who had banished her to this dungeon. She reached under the metal table, pulled out a heavy black canvas duffel bag she had apparently kept packed since the day she was discharged, and slung it over her shoulder. "Let's go," she said. As she walked past Dr. Alden, the surgeon instinctively reached out, grabbing her arm. "Hastings, wait. You can't just leave a shift." In a movement so fast, Alden's eyes couldn't track it. Claire twisted her arm, breaking his grip, and delivered a sharp, open-handed strike to the center of his chest. Alden stumbled backward, colliding heavily with a rack of saline bags, gasping for air. "Do not ever touch me again, Doctor," Claire said, her voice deadly quiet. "Bring him." Campbell suddenly ordered, nodding toward the gasping Alden. Claire stopped. "Arthur, no. He's a liability. He's a liability, but he's also a board-certified cardiothoracic surgeon," Campbell countered. "Hayes's aortic valve might be nicked by the shrapnel. You handle the toxin extraction. We might need Alden to patch the plumbing once the threat is neutralized. Drag him to the bird." Before Alden could protest, 2 JSOC operatives seized him by the arms, dragging the protesting, terrified chief of surgery toward the freight elevator. The UH-60 Black Hawk tore through the gray Seattle sky, banking aggressively toward the Cascade Mountains. Inside the vibrating fuselage, the noise was deafening. Dr. Alden sat strapped into a crash seat, his face a pale, sickly green. He was clutching an oxygen mask to his face, terrified by the sheer violence of the flight. Opposite him, Claire sat perfectly still. The jumpy nurse, who allegedly couldn't handle the pressure of a civilian operating room, was currently field-stripping a specialized vacuum-sealed surgical kit while pulling 2 Gs in a military helicopter. Her face was a mask of pure, unadulterated focus. 20 minutes later, the helicopter descended rapidly into a concealed concrete bunker nestled in the foothills of Mount Rainier. The moment the skids hit the tarmac, Claire was moving. Alden was violently shoved out of the helicopter by the operatives and forced to jog behind Claire and Campbell into the underground facility. Sirens were blaring. The lighting was a harsh, flashing amber. Heavily armed soldiers in chemical warfare suits rushed past them in the narrow concrete corridors. This wasn't the pristine, temperature-controlled environment of Seattle Metropolitan Hospital. This was a nightmare of noise chaos and impending death. They reached the containment wing. Through thick lead-lined glass, Alden saw the makeshift operating room. It was essentially a sealed plastic bubble. Inside, Agent Jonathan Hayes lay on an aluminum table, his chest a mass of bruised, ruined flesh. His breathing was wet and ragged. "Suit up!" a logistics officer barked, shoving a heavy claustrophobic Level A hazmat suit into Alden's chest. "You have 3 minutes." Alden's hands were shaking violently. He couldn't align the zippers of the thick rubber suit. His breath fogged the visor, and his heart hammered wildly against his ribs. Panic, pure and paralyzing, set in. I can't do this," Alden hyperventilated, backing away from the airlock. "I can't operate in this. I can't feel the instruments through these thick gloves. It's too loud." Claire, already fully suited and sealing her oxygen rebreather, walked over to him. Even through the thick, distorted visor of the hazmat helmet, her eyes were piercing. "Look at me, Alden." Her voice crackled over the secure comms channel in his earpiece. Alden looked up, trembling. "This isn't a string quartet," Claire said coldly. "This is war. If you panic in there, I will physically remove you from the sterile field. You will stand in the corner, you will keep your mouth shut, and you will speak only if I ask for an anatomical consult. Do you understand?" Alden, the great chief of surgery, could only nod weakly. They entered the airlock and then the containment bubble. The heat inside the suits was immediate and oppressive. The only sound was the heavy Darth Vader-like hiss of their own respirators and the erratic, terrifying blip of Hayes's heart monitor. Claire approached the table. She didn't hesitate. She didn't wait for permission. She took total command. "Starting the clock. I need a localized negative pressure vacuum over the entry wounds. Alden, hold the suction tubing at exactly 45 degrees. Do not move your hand a single millimeter, or we all die." Alden took the heavy plastic tubing. His hands were shaking so badly, the tube rattled against the metal table. "Steady your hands, Doctor," Claire barked over the comms, her voice cracking like a whip. "Deep breath. Lock your elbows." Alden forced himself to obey, relying entirely on her unyielding command to keep his knees from buckling. With terrifying precision, Claire picked up a scalpel. Despite the thick, cumbersome rubber gloves of the hazmat suit, her movements were fluid, aggressive, yet flawlessly calculated. She sliced through the necrotic tissue, bypassing the standard protocols Alden would have used. She wasn't just doing surgery. She was diffusing a biological bomb. "I see the primary shrapnel cluster," Claire announced calmly. "The ampule is lodged against the pericardium. Tissue is highly degraded. Vacuum is holding." Alden watched in absolute awe. The lighting was terrible, the alarms outside the bubble were screaming, and the heat was unbearable. Yet Claire was in a state of flow that Alden had never achieved in his entire career. Her hypervigilance, the very trait he had mocked, allowed her to simultaneously monitor the patient's collapsing vitals, the structural integrity of the chemical ampule, and Alden's trembling hands. "Forceps," Claire muttered to herself, grabbing the tool with her left hand while maintaining tissue retraction with her right. Slowly, agonizingly, she reached into the bloody cavity. For 10 seconds, nobody breathed. The only sound was the hiss of the oxygen tanks. With a soft click, the forceps locked. "Extraction," Claire said. She pulled a jagged, bloody piece of twisted metal from the chest cavity. Attached to it was a miraculously intact glass cylinder, glowing with a faint, sickly yellow liquid. She immediately dropped it into a heavy lead canister, filled with a neutralizing chemical bath, and slammed the lid shut. "Threat neutralized," Claire said over the comms. "General Campbell compound, 73, is contained." "Copy that, Major. Incredible work." Campbell's relieved voice echoed in their helmets. Claire turned to the massive wound in the agent's chest. Arterial bleeding. The aortic arch is lacerated. She looked at the chief of surgery, who was staring at her, completely dumbfounded. "Your turn, doctor," Claire said, stepping back. "Patch the plumbing." Alden moved forward, but as he reached for the needle driver, his nerves finally shattered. His hand spasmed, and the heavy surgical instrument clattered loudly onto the metal floor of the containment bubble. He froze, staring at the dropped tool, his own past words echoing in his mind. "You are a clumsy liability." Claire didn't yell. She didn't demean him. She simply sighed, a sound of profound exhaustion, and picked up a spare needle driver from the tray. "Step aside, Richard," she said softly. "I'll finish it." And she did. In less than 20 minutes, Claire Hastings repaired the lacerated aorta, stabilized the chest cavity, and prepared the operative for transport to the intensive care unit. Alden stood in the corner, entirely useless, stripped of his ego, watching a true master at work. 2 days later, Dr. Richard Alden returned to Seattle Metropolitan Hospital. He walked through the pristine, quiet hallways of the surgical wing, but the arrogant swagger was permanently gone. He didn't yell at the residents. He didn't grandstand for the galleries. When he looked at the scrub nurses, he no longer saw them as mere props in his grand performance. Down in the sub-basement, the metal folding table was empty. The clipboard lay abandoned. Claire Hastings never returned to the hospital. A week later, a federal courier delivered a heavily redacted letter to the hospital director's desk. It was a formal resignation, accompanied by an executive order from the Pentagon. Major Claire Hastings had been appointed as the Director of Combat Medical Operations for the Joint Special Operations Command in Washington, D.C. Her final act before leaving Seattle, however, was leaving a small, unmarked package on Dr. Alden's desk. When Alden opened it in the privacy of his office, his hands trembled, just as they had in the bunker. Inside was a single polished silver mouthpiece for a tuba resting on a bed of sterile gauze. Accompanying it was a handwritten note on military letterhead to Dr. Alden. "Nursing is a symphony. Try to keep up with the music. Major C. Hastings. If you loved this story of absolute justice and dramatic redemption, hit that like button. Right now, don't forget to share this video with someone who loves a brilliant plot twist, and subscribe to the channel for more incredible real-life, inspired medical and military dramas. Drop a comment below. What would you have said to Dr. Alden?